Hey everyone, and welcome back for another deep dive. Today, we're going to be looking at something that's super important to millions around the world. It's managing diabetes during Ramadan. And we've got a really interesting mix of sources for this one. We've got interviews with medical experts from both Pakistan and the US, some super insightful webinars from the UK, and even some personal stories from individuals who are actually navigating this whole experience themselves. We really want this deep dive to be practical and useful for you. So we're going to try to give you some actionable insights on how to approach Ramadan if you have diabetes, or if you're supporting someone who does.
Yeah, I'm really glad we're tackling this topic. I think it's one where faith and health and culture all kind of intersect.
Totally. And because it is such a personal experience, we really need to understand the whole picture. So let's start with the basics. You probably already know this, but there are two main types of diabetes. Type 1, where your body doesn't produce enough insulin, and type 2, where your body isn't using insulin efficiently. But did you know that diabetes is actually really prevalent in a lot of Muslim-majority countries?
Yeah, that's true. And you know what that means. There's already a strong network of support and shared understanding in these communities. It also means that it's super important to have healthcare professionals who are culturally sensitive and who really get the unique challenges and considerations of managing diabetes during Ramadan.
That's such a good point. It's not just about the medical side of things,
Yeah.
but also understanding that cultural and spiritual context.
Absolutely. For example, Islam actually exempts those who are ill from fasting. And that includes people with diabetes. But a lot of people with type 2 diabetes, they still choose to fast. And this really highlights just how deeply spiritual and significant Ramadan is.
Yeah, it really does. It's a powerful reminder that this is a really personal decision. And that's why having accurate information is so important. Speaking of which, one of our sources, UK webinar, highlighted this really cool tool. It's called the Diabetes in Ramadan app, or the DIR app.
Oh yeah, the DR app. I tell my patients about this all the time. It's a great example of how technology can help people make informed decisions about their health. So the app has this risk calculator that considers all sorts of factors, like the type of diabetes you have, how long you've had it, your history of low blood sugar, any other health conditions you might have, even things like your job and how physically demanding it is. It also looks at your past experiences with Ramadan and how well you managed your diabetes during those times.
Wow, that's really comprehensive. So it sounds like it really personalizes the assessment.
It does. And then based on all those factors, it uses this simple traffic light system, red, amber, green, to give you an idea of your risk level if you do choose to fast.
Okay, so even if someone gets an amber or a red light, it doesn't mean they can't fast, right?
Exactly. It's about giving people the information they need to make informed choices in consultation with their doctor and with their faith.
That makes sense. So knowing your risk level is step one. But what about after that? What comes next? Let's get into the practical side of things, and let's start with medication management.
Okay, so this is where things can get a little complicated, especially if you're taking certain medications for your diabetes. But the good news is, a lot of common medications like metformin are generally considered safe to use during Ramadan, but you might need to adjust the dosage, depending on how many times a day you usually take it.
So it's not just about can you take the medication, but also how you take it.
Right, and it's really important to talk to your doctor about any potential adjustments well before Ramadan starts.
Yeah, that makes sense. Our Pakistani experts also pointed out some important things to consider about some other medications. For example, they said that newer generations of sulfonylureas, like Glypride, are often preferred over older ones because they have a lower risk of hypoglycemia, which is low blood sugar, during fasting.
Oh, that's a really good point. You know, medicine is always advancing, and it's important to stay up to date on the latest recommendations, especially in situations like Ramadan, where your body's metabolism and routines are different.
Absolutely. They also talked about SGLT2 inhibitors, which are generally considered safe for Ramadan. But you have to be really careful about staying hydrated. So drinking plenty of water throughout the non-fasting hours is super important to avoid dehydration.
Yes, definitely. Staying well hydrated is important for everyone during Ramadan, but especially for people with diabetes who are taking these medications that can increase the risk of dehydration.
Right. And then there are the GLP-1 receptor agonists. These are interesting. They're effective for both weight management and blood sugar control, and usually don't require dose adjustments during Ramadan.
That's right. GLP-1 receptor agonists can be really helpful, but one thing to remember is that they can sometimes cause nausea. especially when you first start taking them. So if you're thinking about starting this type of medication, it's best to avoid starting it too close to Ramadan, just to minimize any potential discomfort during the fast.
That makes sense. So far, we've talked about medications that are taken orally. But what about insulin? It seems like that would require more careful management.
Absolutely. Insulin's a powerful medication, and you definitely need to adjust it during Ramadan. The adjustments depend on the type of insulin you're using. So like if you're using basal insulin, which provides a steady level throughout the day, or bolus insulin, which you take around meal times to cover that immediate rise in blood sugar, or if you're using a mix of both.
So it's not a one-size-fits-all approach with insulin?
No.
Not at all. It needs to be very personalized. That's why it's so important to work closely with your doctor to come up with an insulin plan that's right for you. And a big part of that plan is monitoring your blood glucose levels frequently, especially in the late afternoon, because that's when they can really fluctuate.
So managing insulin during Ramadan takes a lot of planning and communication with your doctor.
You got it.
Okay, so we've talked about medication, but what about nutrition during Ramadan? That seems like it would be a big part of managing diabetes too.
Oh, absolutely. Nutrition is key. And one of the most important things for people with diabetes who are fasting is to make sure they don't skip suhoor, the pre-dawn meal.
Oh, why is suhoor so important?
Well, if you skip suhoor, you're basically extending your fasting period. And that can cause some pretty big swings in your blood sugar levels and increase your risk of complications.
Right, that makes sense. So it's all about planning your meals strategically to keep your blood sugar stable throughout the day. Exactly. One way to think about it is try to spread your calorie intake out over 2 to 3 meals during the non-fasting hours. So a good rule of thumb is have about 30 to 40% of your daily calories at suhoor, 40 to 50% at iftar, which is the evening meal, and then the remaining 10 to 20% as a late night snack, if you need it.
Okay, so that's the timing. But what about the types of food? Are there certain things that are better to eat during Ramadan? If you have diabetes?
Yes, definitely. One of the best tools I recommend to my patients is the Ramadan plate. I learned about it from those Pakistani experts we talked about. So picture your plate, divided into 3 sections. Half of it should be filled with non-starchy vegetables, a quarter with lean protein, and the last quarter with complex carbohydrates.
I love that, the Ramadan plate. Such a simple way to think about balanced meals.
It is. And when you're choosing your carbs, go for complex carbs like whole grains, beans, lentils, brown rice. Those are digested more slowly. So they help prevent those big spikes in blood sugar. That you can get from eating refined carbs like white bread or sugary sweets.
Right. It's all about those slower digesting carbs.
Exactly.
And I imagine it's especially important to avoid sugary drinks and fried foods, which can be pretty tempting during Ramadan.
You're telling me? Those are the worst things for your blood sugar. It's best to limit those as much as possible and focus on staying hydrated with water, unsweetened tea, or milk.
Makes sense. You know, it's interesting. Some people experience other issues during Ramadan related to changes in their eating habits. Things like caffeine withdrawal, constipation, or indigestion.
Yeah, those are pretty common. For caffeine withdrawal, you can try gradually reducing your caffeine intake in the weeks leading up to Ramadan. And for constipation, make sure you're drinking lots of fluids and eating fiber-rich foods like fruits, veggies, and whole grains. And if indigestion is a problem, try eating smaller, more frequent meals and avoiding spicy or fatty foods.
Those are great tips. It sounds like being prepared can make a big difference in how Ramadan goes, especially for people with diabetes.
Absolutely. And it's not just about the individual. Our sources really emphasize the importance of community and family support during Ramadan.
That's a really nice point. I imagine it makes a big difference to feel supported, especially when you're managing a condition like diabetes.
It does. We came across some really inspiring examples of how communities are coming together to support people with diabetes during Ramadan. Some mosques are putting on educational sessions about diabetes management and healthy eating, and others are hosting special iftar gatherings that are specifically catered to people with dietary needs.
Wow, that's amazing.
Yeah.
It's great to see how these faith communities are stepping up to create a more inclusive environment.
It is. And families play a big role too. They can help with meal planning, grocery shopping, and just creating a positive and supportive atmosphere.
But it's a team effort.
Exactly. And Ramadan is about more than just the physical aspects. It's a time for spiritual reflection and growth, a chance to connect with your faith, your community, and yourself.
That's a beautiful way to put it. So we've talked about the preparation and the journey through Ramadan. But what about after Ramadan ends?
That's an important question because it's not just about managing diabetes during the month of fasting. It's about understanding the long-term impact and making changes for future Ramadans. All of our sources stressed how important it is to see your doctor for a follow-up appointment after Ramadan ends.
Yeah, that makes a lot of sense. It's like a check-in to see how things went, what worked well, and what you could maybe do differently next time.
Exactly. It's a time to look back at your blood sugar logs, talk about any challenges you might have had, and make any adjustments to your medication or lifestyle, before the next Ramadan.
So it's a good opportunity to learn from the experience.
It is. And speaking of learning, one thing that really stood out to me from all our research was the potential for technology to really help people with diabetes, especially during Ramadan.
Yeah, definitely. We talked about the DR app earlier, but it seems like there's so much more we could be doing with technology.
There is. Just imagine. Personalized apps that not only calculate your risk, but also give you real-time feedback on your blood sugar levels. And maybe even suggest adjustments to your medication or diet.
Okay.
Based on your data.
Wow, that would be amazing. Like having a virtual diabetes coach in your pocket.
Exactly. And then there's telehealth. Virtual appointments with diabetes educators or endocrinologists could make specialized care accessible to so many more people.
That's a great point, especially for people in rural areas.
Yeah.
Or places where there aren't a lot of healthcare providers.
Right. We've already seen how technology can empower people to take control of their health. But imagine the possibilities if we combine that technology with the human touch.
Yeah, it's all about finding that balance between the technology and the human connection.
Exactly.
So as we wrap up our deep dive into managing diabetes during Ramadan, what are some of the key takeaways for our listeners?
Well, I think the most important thing to remember is that managing diabetes during Ramadan is a very personal thing. There's no one-size-fits-all approach. It's about understanding your own individual needs, making informed decisions, and working closely with your healthcare team.
And don't forget about the importance of community and family support.
Oh, absolutely. Talk to your loved ones, reach out to your faith community, and don't be afraid to join online support groups or look for online resources. You're not alone in this.
It's really inspiring to see all the progress that's been made in understanding and managing diabetes during Ramadan. And it seems like there's even more to come.
Oh, for sure. I'm really excited to see what the future holds.
Well, we've covered a lot today, from the risks and challenges to practical tips and the power of technology. Hopefully our listeners are feeling empowered and ready to approach Ramadan with confidence.
I hope so. Ramadan is a special time, and we want everyone to be able to experience it fully and safely.
Remember, knowledge is power. The more you know about your own needs and the resources that are out there, the better prepared you'll be.
And never be afraid to ask questions. Your doctors, your religious leaders, your community, they're all there to support you.
So go out there and embrace the spirit of Ramadan and take care of yourselves.
Until next time, stay curious, keep learning, and Ramadan Mubarak.
Ramadan Mubarak.
Feeling distressed and fearful about taking insulin is a common experience for many people with type 2 diabetes. It's important to remember that insulin is a life-saving medication that can help to control blood sugar levels and prevent serious complications. It is crucial to follow the advice of healthcare providers and trust in the treatment plan recommended for your individual. Seeking support from healthcare professionals, diabetes educators, and support groups can help in managing these fears and concerns. For better management, please visit DiabetesWala.pk and consult Dr. Irfan Safi, the leading diabetologist. Please like and share this public service message.